We're talking with Dr. Richard Isaacson about Alzheimer's disease. And doctor, can you talk about the boom or the increase in recognition in this disease in the past 10 to 20 years? What's behind that?
Right. So, when my Uncle Bob had Alzheimer's, was first diagnosed with Alzheimer's disease, back when I was in high school 15, 20 years ago, we had no treatments, we had nothing. We didn't even know how to diagnose or recognize the disease. Back then, we thought that as people aged, they would get senile, and that was normal aging. Well, we now know that Alzheimer's disease is not normal aging, but really what's come about is we've been able to diagnose it better because we have newer technologies now. We also understand through research studies that there's a difference between normal aging and Alzheimer's disease. So with the aging population, as the baby boomers are getting older, the number one risk factor for Alzheimer's disease is advancing age. So we've been able to see many more cases and really improve our understanding of how to diagnose the disease.
So there's not more instances of it necessarily. It's just been something that's better diagnosed.
Correct.
Over the last couple of years.
There's, I would say that it's much better diagnosed now. Is the incidence increasing? There's a whole variety of medical illnesses that can increase risk of Alzheimer's disease. For example, high blood pressure, diabetes, cholesterol, all of the typical things that can cause a stroke can also increase risk or advance the onset of Alzheimer's disease. So, it's a tough question to say for exactly, but in general, advancing age is the cause.
How is it diagnosed? And is it often misdiagnosed? I would think too, because it's, like you said, we always thought that when you get older, you just kind of get more senile, but how do you determine what is exactly Alzheimer's disease?
Right. So the best way to diagnose Alzheimer's disease is by listening to what the symptoms are, talking to the patient, talking to the caregiver, talking to the family, and really trying to figure out from the clinical history or the story of the patient. And that's really the best way to figure it out. You can do a variety of tests. You can do blood tests and x-rays of the brain, imaging studies, but truly in my clinical practice what I use is the good old-fashioned clinical history. If you have a progressive history of short-term memory loss that's combined with anything like problems with language, difficulties with sleep, changes in behavior, getting lost, losing keys, losing objects. When you have that history or that story, that's really the best way to diagnose Alzheimer's disease.
Is it different in each patient though? I know with some patients there can be, you talked about the short-term memory, some with violence, agitation. Does that make it tougher to diagnose, or is it all encompassing?
Well, every patient does present differently. Some patients with Alzheimer's may have only short-term memory loss and everything else is relatively intact. Other patients can start off with depression, agitation, aggression more early. It's not always straightforward, and there are patients that our center has diagnosed with Alzheimer's disease, and years later, when we actually look at the brain, they actually didn't have Alzheimer's disease. They had something else like frontotemporal dementia, which is another type of cognitive impairment. So there's no 100% foolproof way of figuring out Alzheimer's disease. However, now in 2011, we can do new imaging tests, an MRI of the brain, a magnetic resonance imaging study can look at the memory center of the brain, or the hippocampus, where the memories are stored. And if that's small or shrinks up, then maybe that's more common for Alzheimer's disease. There is another study called a PET scan, a positron emission tomography, and newer labeling agents where you inject the patient and you can actually label the pathologic protein or amyloid protein in the brain. And that can sometimes tell the difference between Alzheimer's disease, frontotemporal dementia, and also by doing a physical exam, you can tell the difference between other forms of cognitive impairment or dementia.
How important is it to get diagnosed?
Oh, the earlier you get diagnosed, the earlier you can treat. And in my clinical experience, the earlier you treat, the absolute better you do. There's no one magic bullet for Alzheimer's treatment. There's no one magic bullet or magic pill for Alzheimer's prevention. But it's the combination of multimodal approaches, a comprehensive approach. It's like making a nice stew. You want a little bit of this, a little bit of that. All of these ingredients work together to help both treat and prevent Alzheimer's disease.